Hi, Mom. My name is Lazarus, and I'm a clinical psychologist that has a special interest in maternal mental health. Having a baby is one of the most profound moments in a parent's life. It is a moment of pure elation and joy, but it also can be accompanied by fear and apprehension and a sense of anxiety. There is so much that goes into the preparation of a birth and the preparation of becoming a parent. And this takes place actually before the pregnancy itself, before conception, when you're planning on becoming a parent. One often fantasizes about the type of parent that you'll be, or that exact moment when you'll hold your baby in your arms, and that sheer joy that you'll feel accompanied with this. This is true. Becoming a parent is a beautiful experience and often accompanied with a lot of happiness and a lot of excitement. But what I find that is often not talked about is sometimes the more difficult emotions associated with becoming a parent. Sometimes becoming a mom can be associated with feelings of sadness, frustration, and even a sense of loss as one tries to adjust to their new role as a mother and caregiver. The first 2 weeks after giving birth is what people often call as or refer to as the baby blues. This is a period where, new mothers begin to adjust to their new roles, becoming a parent. And it's a difficult adjustment. However, it is these fears or these anxieties that are not talked about. I think, the concept of feeling less than joyful, less than elated when becoming a new mom is often taboo. And there's a lot of stigma associated with that. Women are expected to just feel this all-consuming love for their new baby. And that's wonderful, and it does happen. But I think what we cannot ignore is the judgment associated or put on women who might struggle emotionally in adjusting to their new role. And this is where postnatal depression comes in. You might ask, what differentiates postnatal depression from that of a normal adjustment as described as in baby blues? Postnatal depression is different from baby blues as it occurs within the first 4 to 6 weeks post-birth, where a woman predominantly feels a low mood. You're feeling sad for most of the day, for most days. There's changes maybe in your appetite, in your sleep patterns, besides having a baby to care for. Changes in memory and concentration. Some women might experience suicidal ideation. And it is so difficult for women to speak out when they feel like this due to fear of judgment or that stigma that we had spoken about. And what is so important, especially now, given the times that we find ourselves living through this pandemic, it is so important to get that support wherever you can. That you seek support from your loved ones, whether it's someone dropping off a meal, whether it's someone, asking your partner to watch the baby while you have a shower, whether it's speaking to your doctor, feeling like you need extra support. It's okay to seek support. And I think that's the biggest factor in postnatal depression, is that often women feel ashamed to seek support and don't know where to go for support. But there is support available, and that's the most important thing to know, is that you are not alone if you find yourself going through this. And the only way to shatter the stigma around postnatal depression is to speak out. And having given you that message, new mommies to be, stay safe, look after yourselves, and enjoy this journey that you're about to embark on, both the glorious, wonderful moments, and also embrace those moments that are hard, that are difficult, because ultimately that is the process of becoming a mom.